Hello, and thank you for joining me on this series of cancer here at the Envita whiteboard. And many patients ask me, why do they need to come to Envita? Why Envita as a clinic? And you know, I don't want this to turn into a marketing piece about Envita. I want to turn this into an education piece for you because you understand this. But why Envita? Why have we dedicated 10 years or over a decade of our time in working with advanced cancers and helping patients? And the answer is very simple. It's because you want a comprehensive plan. And remember, I talked about the game plan and breaking it down. So I'm going to do a little pie chart and explain to you what happens when you come into Envita and what has happened traditionally in the world of oncology. A patient comes in, sees their doctor, and they get put under a program. Typically, that program is a protocol. And the protocol is typically a very general protocol, meaning it's more commonly. You've gone to your oncologist, you've been diagnosed recently with cancer, and you go in, and so you're rushed in, and sometimes there's surgery and then chemo, and there's been a lot of time to ask many questions, and you're on this program that's been a pre-designed protocol, okay? Now, if that works, great, you know, at least in the beginning, that's great. The problem is what happens when it doesn't work, or we only go into remission for 1 or 2 years and then the cancer comes back. That's what we're talking about, is a more comprehensive plan. So what happens now that all of a sudden you did that protocol and it didn't work, and now I've done another chemo protocol, that didn't work, okay? The difference is that this technique is for the masses. People go into it, they get a general intake, they're going to get the standard treatments and protocols. At Envita, this is how we do it differently, and this is how the appointment works. You come in and you see our doctor, which is usually about, like I said, an hour and a half or longer appointment with a team really working to see what are the best options for you. And when we were looking at the best options, you remember in the earlier series of the game plan, the importance of how to select chemotherapeutic drugs, how to select the right radiation therapies, how to select the right advanced natural therapies which are unique to Envita so that our patients can have the best outcomes. So the first thing is you come in and a plan is generated. The second thing is then there's an execution to that plan, which means the timing of treatment is very, very important, and I'm going to go into that just briefly. So, for instance, we have a tumor. Is the radiation going to go first? Is the chemo going to be used at the same time? Is the chemo going to go first? Is the advanced natural medicine going to be used? So the treatment execution and the scheduling is critical because it's going to be done specifically for your best benefit. So now not only do we know what treatments we're going to use, but we're going to have a schedule, a plan, and timing of how that's going to be delivered. Then the other important part is follow-up. If you know much about cancer, one of the most common things you'll hear from your doctor is, we'll know you're well when, you know, several years have gone by and the cancer doesn't come back. And that's a good answer. But what's important is we can use other tools to have a more comprehensive follow-up. So of course we're going to use radiographs like X-rays, MRIs, CTs, right? These imaging is going to help us. But we're also going to use other factors to look at follow-up, like the immune system, toxicity, overall health, the quality of life. What about the quality of life? Are you better? Do you have more energy? Are you able to move? This brings me to a patient I remember came into our centers and had prostate cancer, was moving around with a walker. We were able to help with the quality of his life. And within, I think it was like 4 or 5 weeks, I heard a big motorcycle in the parking lot, and he was driving in on his motorcycle because quality of life is critical. You don't just want to get well and deal with the cancer, but what's your quality of life? Are you able to get back to the things that you want to do and have the energy that you need to? And then finally, what happens very commonly is that it's not necessarily the cancer that kills you, but the side effects that can occur from the combination of chemotherapy, radiation, or cardiovascular risk factors that cancer patients have, circulatory risk factors. So what happens is sometimes we get so focused with cancer that we forget about the heart disease risks that can come from cancer, circulatory problems. You know, cancer patients can have blood clotting issues, right? So what we want to do is look at the total health of the person and not forget that health is a whole picture. It's not just focusing narrowly on the cancer, but the total health. Does the person have more energy? Their circulatory and cardiovascular functions and other things doing well, because that's part of returning you back to health. There's a difference between a plan and healing and using the advanced therapies, natural therapies in combination, in sequence, and not just using it if everything else doesn't work. Does that make sense? So a lot of people think, well, I'm going to try the standard stuff, and then eventually someday, if that doesn't work, I'm going to go into the natural, or I'll finish my general protocol and then go to it. But it's more important that you get the full picture and understand a full plan right up in the beginning so that you can build it and get the best of every single therapy that's out there and the best for you. So I hope this was helpful in helping you understand why these therapies, why natural medicine, why this overview on cancer. So thank you for joining me today at the Envita Whiteboard.